5 Steps to Become a Licensed Practical Nurse. Brought to you by medicalfieldcareers.com. What does an LPN do? While working under the direct supervision of either a registered nurse or physician, practical nurses and vocational nurses perform a variety of direct patient care tasks. In cases where an LPN has acquired specialized certifications and training, the list of responsibilities can be greatly expanded. Here are some of the examples of the tasks for LPNs. Monitor the health of patients by performing routine tests. Report patient status to the supervising RN or physician. Maintain accurate, updated records on patient health and status. Provide essential patient care. Administer medication, and collect tissue and bodily fluid samples for testing. The 5 steps to become a licensed practical nurse. The process for becoming a licensed practical nurse can be broken down in the following 5 steps. Step 1. Meet the entry requirements for formal LPN training. Step 2. Choose the type of credential you want to earn, a certificate, diploma, or associate's degree. Step 3. Enroll in a state-accredited LPN program. Step 4. Pass the NCLEX PN exam. And Step 5. Receive your license and apply for jobs. Step 1. Meet the entry requirements for formal LPN training. All formal LPN and LVN programs have a basic minimum requirement that applicants have a high school diploma or GED. If you intend to pursue a career in practical nursing, you must first ensure that you can meet this basic prerequisite. Some programs also have academic prerequisites that applicants must meet. These typically come in the form of courses that need to have been completed in high school and minimum GPA requirements from these classes. Step 2. Choose the type of credential you want to earn. Before becoming eligible to sit for the NCLEX PN exam and test for your license, you must first earn a credential from an accredited LPN program. There are 2 primary types of credentials that these programs offer. You should choose the one that best fits your career goals. They are certificates and diplomas. Programs that offer certificates or diplomas in practical nursing focus entirely on preparing students to take the NCLEX PN exam. As a result, these programs are usually quicker. Many can be completed in as little as 12 months and less expensive to complete than associate degree programs. Associate degrees. Associate degree programs are considerably longer than certificate or diploma programs, with most lasting 2 years as opposed to 1. The extra study time is dedicated to providing students with a broader set of skills beyond just those required to perform the daily responsibilities of a practical nurse. Step 3. Enroll in a state-accredited LPN program. Once you have decided on the type of credential you want to pursue, the next step is finding an accredited program that offers it. The key here is that the program must be accredited, as only graduates from accredited programs are eligible to sit for the NCLEX PN exam needed for your license. Each state has its own individual accrediting body that oversees practical nurse training, although many of them defer this responsibility to the Accreditation Commission for Education in Nursing. In any case, you should check with your state board of nursing to find out who the accrediting body is in your state for LPN programs. Step 4. Pass the NCLEX PN exam. All 50 states require anyone employed as an LPN or LVN to have passed the NCLEX PN exam. A passing score on this test is required in order to become nationally licensed. The exam is made up of 4 sections, each of which focuses on a specific area of the practical nursing profession. The list below displays each of these 4 sections and roughly what percentage of the total exam they represent. Step 5. Receive your license and apply for a job. The final step in the process of becoming an LPN is to receive your license and start looking for your first job. After you take the NCLEX PN exam, you should receive your test results within as little as 48 hours. Your local state board of nursing will usually then send your license to you via mail within 2 weeks or less. Once this formality is concluded, you'll be able to start applying for jobs as a newly minted licensed practical nurse. Before you go, check out our annual $1,500 healthcare scholarship. Come to medicalfieldcareers.com and fill out the scholarship application and submit your 1,000-word essay on why you would like to work within the healthcare field, and maybe you can get some of your LPN training paid for by us.